Dr. Eldon Dahl, it's lovely to have you back and have a little chat with you about one of your not newest products, but a product that's been reinvented, shall we say. How are you keeping? You're enjoying the bit of summer we're getting?
Every bit of sunshine I'm enjoying that I get, and it's great to be on your program again. It's always enjoyable to speak with you because you know the right questions to ask, and uh, and you're an intelligent lady.
Well, thank you for the compliment. I don't know if I know the right questions, but I just tend to go with whatever comes out of my mouth. So, but our last conversation was very good. I really enjoyed that. But today we're going to discuss your product Claw. Claw stands for claw or to bind in Greek. And that's, I think, where you came up with the name. And we had mentioned on the last podcast that once it was re-released, we would give the listeners some insight on what it is, what's it good for, why did you create it, all of the above.
Yeah, it's the Greek. It comes from the Greek word chele, or to claw away. So to bind and to take out of the system is claw. And so it's the perfect name for a product that is designed to be an oral chelation product.
So it's chelation at home, pretty much.
Well, the ingredients are chelation effective because it has the EDTA, has malic acid, and it has several other of the ingredients that work within the heart and the blood vessels. And
So let's just go with the EDTA first. A lot of people have a lot of reservations about EDTA and claiming it's not safe. Why did you choose to go with that? And clearly, you feel it has safety and efficacy in the body.
well, there's different forms of EDTA. The EDTA that you find that's in lining the cans of Campbell soup or something like that, that's industrial grade. We're talking medicinal grade. That's suitable for internal intravenous use. EDTA chelation therapy has been performed probably over 500,000 times by doctors around the world. It's probably one of the most safe technologies and treatments there is for pulling out heavy metals and clearing the arteries. And basically, they use it as a means before a bypass. Many of the times it can eliminate the bypass. It was recently, I think probably going back now 5 years, they did a big study. This doctor did a big study, and he wanted to actually disprove EDTA chelation. And that's what he did. And he actually got $7 million grant to do this study. I can't get $100 from the government. He's got 7 million.
Well, I
uh,
wonder who gave them that.
yeah, I mean, I think they like the idea that here's this practice that can do away with what probably one of the most if, cost people making a ton of money on doing bypass surgeries.
Mm.
It's very expensive, and they make a lot of money, hospitals and doctors alike. And if they can eliminate this chelation, this drip therapy, then let's do it. Okay, here's the money. We'll make it up once you discredit it all.
Yeah.
Well, after they found out with the study, it was actually benefiting the patients. And he was finding that it also did away with people that have diabetes. By up to 40% were actually having a recovery of their diabetes by doing this.
No way.
And then he thought, well, I need to do another study again on it. So another 7 million was spent later on. And the results, they how they picked the candidates this time and how they did it They made it look like it wasn't as effective, and it wasn't effective for treating diabetes, but it was. The first test was the best because you didn't uh, pre pre-select the candidates.
Yeah. So they cherry picked who they wanted to
Well,
be
they did.
to
Yeah,
tilt the results in the direction they wanted it to go in.
exactly.
So they
Yeah,
published both studies, I'm assuming.
they did, and I can send you the studies.
Yeah, that would be awesome. The diabetes, like I knew chelation was affected for many things, but not diabetes. And as we always say, and it doesn't seem to be getting better, diabetes is on the rise. It just never stops.
Well, it's a product of our environment, our diet. Uh, it's nothing, unusual. I mean, if you understand the human body and anatomy, and you see what we're doing to the body, you can see it's going to break down.
Yeah.
And the first part is going to be your pancreas, and it won't be able to function properly. And then it's going to affect your liver, and of course, liver is up, and of course, obesity is up. Everything you can look at. Take the normal person, and then you take person like, say, from today, that you classify as a normal person today, or a normal person, say, for 20 years ago or 30 years ago, let's say. And
Mhm.
you put them side by side and you check their bodies. Completely different. We didn't have, cancer clinics for children all over, and that wasn't like that.
I know it's just the odds are stacked against us, and I suppose part of what infuriates me is, and this is not where the conversation's going, but over the last 10 or 20 years, we've had the advent of paleo, the ketogenic diet, then carnivore, vegan, and all of these diets have proposed to cure all of our ailments, yet we're worse than we've ever been. Like
Yeah.
nothing has worked, which tells me as well, it's not necessarily the diet as much as it is the person and their lifestyle choices.
Well, diet is important, but first you have to have the body into a state where it can accept proper food. And this is what I used to recommend claw for.
Mm.
When anyone would come in to see me with a sickness or a medical condition, I would say the first thing we need to do is get you cleansed. You need to do a detox. We need to, and how we devised it was, depending on the person's age, if they were, say, 40 years old and they had symptoms that were showing that they needed a cleansing, just like when you go take your car in for a oil change or change the filters. You need to do those things. But how many times do we do that for the human body?
Most people never.
Never, no. And then they wonder why they're pulling along all this, the extra metal, and they're, if you touch onto a magnet, they stick because you don't get rid of it.
Mhm.
So your gut is not in balance. So for my philosophy was always, let's clear the arteries, let's clear the plaque from the brain, let's take it from the joints, let's take the lead, the calcium, excess calcium, the inorganic calcium that doesn't get absorbed anyways from the calcium that they're feeding the people today is just atrocious. Oh man, I could go on a whole conversation on that, but it doesn't absorb to the cells. And then of course, when you look at, you've got uh, the chemtrails, so um, you've got lead, you've got mercury,
Aluminum.
aluminum is everywhere. And then, so all these are plaquing up the arteries. And then, of course, the fats in the diet, the wrong fats are plugging the arteries, too much high omega-6, processed foods. If it doesn't get absorbed, it's either, and most people, a lot of people are constipated now and
Mhm.
obese. So it's not getting out of the body, so it's circulating.
Yeah.
So the treatment is clear out the arteries, clear out all the plaque from the body, and then the way the chelation works, this one, claw is it eliminates it through the kidneys and the bowels. And then you can do after this, then I recommend to treat the gut. Bring that into a state of balance. Get the intestinal flora back on track. Once the gut and your arteries are cleared and in balance, now we can start talking about your diet, because now your food is going to digest and be processed properly, and you'll be able to function. Your brain will be able to, fire like it should be. You don't need to rely on all these morning coffees, Red Bull, and all this other stuff just to get you through the day.
Well, I like my coffee, so I have so many questions, Dr. Dahl, as you're talking. So first I want to know, so how does the EDTA help with the diabetes? Like what was the mechanism of action? I can only assume that by chelating, it was taking a lot of the burden off the liver and the pancreas and helping to reduce inflammation. Am I on the correct lines there?
Yeah, that was right. It was once you start clearing things out, then the body can function now because it's not backed up. You just put a dam on a creek and watch how it builds up. You just open that up and it can actually, all the toxins can leave your body, but you're going to be functioning much better.
How beneficial then is it for the gallbladder and bile sludge, like the toxicity there, but also people that have gallbladder issues? Because you mentioned you also have malic acid in your ingredient list, and malic acid can be very beneficial for the gallbladder.
Yeah, for the gallbladder and for the liver, and it's very helpful for breaking down the fibers in the bloodstream. So that's very beneficial for what we've been seeing in the last 5 years.
Mm.
So the EDTA is a great treatment, and the thing is with the chelation and intravenously, you need to go there at least once a week, and it could be over 20, 30 weeks to the doctor's office, and it's time consuming
Mhm.
and it's expensive.
Mhm.
Uh, and then some people have EDTA in capsule form, and they put way too much in for oral use. They just really don't have an understanding of how the body works. Sure, you can loosen it up. How do you get it out? How do you get it out of your body? So what happens with a lot of their products that they produce is it binds up in the liver. It binds up in the kidneys and the bowels, and you have a bigger problem than when you started.
Because it's almost concentrated and then it's stuck there.
Yeah, it is. And it blocks everything up. And you got all this stuff that you needed to get out. It's now has a log jam.
Yeah. So I have gallbladder issues. I remember telling you before I have hypothyroid, and everyone in my family has hypothyroid. It's an Irish thing. It's an everybody thing nowadays. But
Yeah.
everybody in my family, like on the female side, has had their gallbladder removed,
Ooh,
including my sister. She got hers removed a year ago, and I tried to convince her, no, don't do it. We can fix this. But
yeah.
anyway, of course, I'm a stubborn mare, as they say, and I'm absolutely not sacrificing any of my body parts. Thank you very much. So I decided to take it into my own hands, and I don't get any flares per se anymore. I was having them nightly, every night when the digestion would slow down.
Yeah.
And now I get it once in a while. If I have too much chocolate, to be honest,
Yeah.
that's my weakness.
Huh?
But I might get a little flare and it'll pass pretty fast. But what I'm getting at is it tells me that although I've done a lot of great progress and I can probably keep my gallbladder, there's still a problem there. And I would probably benefit from doing claw to help maybe push that last bit of bile sludge or something out.
Well, everybody can benefit by claw. Everybody should be on a cleanser to clear your arteries, especially today.
Yeah.
I mean, it's just just common sense. So you'll want to do that for, like I say, every 10 years of your life, you would do one bottle.
Oh,
So if you're 40, you would do 4 bottles, 4 months, and then you would take three twice a day capsules. And then you would be taking it with our, on a separate time of the day, you would take our OptiCal Mag with K2.
so you're not taking them together?
No,
Because the way I read it on the box, there's 120 of the EDTA of the claw, and then I think 90 of the Cal Mag. So I assumed it was two of the claw and one of the Cal Mag. That would be your three pills, but you're saying that's not how it is.
no. It's a 30-day supply in the kit. And so there, if you were to take your OptiCal with claw, then your chelation would take the OptiCal out at the same time.
Mm.
So you want to put it in after the claw has done its job, about 2 hours, 2 to 3 hours later. Then you take the OptiCal and you remineralize your body with the good minerals. It takes out the what we call the good and the bad,
Yeah.
and then you must replace the good. And you take two twice a day usually. And we put it in the kit. We don't sell it separate because the Cal Mags on the market today, I wouldn't trust somebody taking claw with those products. They'll have what you call a healing crisis,
Yeah.
and their joints will hurt. Their teeth will become very sensitive.
Mm.
They will have pains in their joints, and it's so that's to tell you the product works. You know, you don't take OptiCal for 3 or 4 days, and then you say, "Oh, wow, give me that stuff," because you'll feel it. I mean, you will.
Yeah, because
And
you're
so,
dumping.
yeah, I mean, it's taking the stuff out that you don't want, that you don't need. If you can pull out aluminum, can you imagine, you know, aluminum, how much there is in our human body? They give, I think they give, like it's normally, I think, 25 micrograms to what they say is a safe daily amount. But the first jab they give to a child, they gave her 250 micrograms of aluminum.
Mhm. And now they're trying to argue that the vaccines were never the problem.
Not if you didn't take it.
Yeah. So how are we timing claw? Because obviously it needs to be taken away from other supplements and medications.
Well, you take it first thing in the morning, and you can take it midday, or you could take it before bed, and take your OptiCal, at other times of the day.
But if people
So,
are taking like thyroid, for example, first thing in the morning, then that might not be a good idea. I would probably recommend if a woman, for example, is getting up during the night to pee, that might be the ideal time to take it because then you're going back to bed for a few hours.
or you could take it with your breakfast and dinner, and then take your OptiCal. OptiCal can be taken with thyroid and then anything else. OptiCal is quite easygoing. It doesn't offend anyone.
One,
And you could take it before bed because it's a calming, and because of the calcium, magnesium, you'll sleep better, and your bones will start to regenerate, and you'll have all that time for it to remineralize yourself.
one of the questions that comes up a lot with binders is if I take it with a meal, will it also bind to the nutrients?
No, not unless you're eating aluminum.
Yeah. You know, a lot of people don't know, Dr. Dahl, I think we spoke about this before, but heavy metals bind to hormone receptors and mimic, especially estrogen activity. And we know we have a lot of problems with that now. So, in saying that, claw can be helpful. I would assume claw can be helpful for helping with hormonal balance.
It helps with your sleep because it helps take the plaque off your pineal gland. It will help with your glands that have become plaqued and bound. What we find is when we get a toxin in our system, I'll just say the last 5 years. So when you're getting these inorganic minerals coming in your spike proteins, then your spike proteins will attract and attach to your inorganic calcium, and it will also attract to your the different metals, the aluminum, and it will attract to the fat, and then it will take it to your glands, and it will plaque your glands, it'll plaque your brain, it'll plaque your arteries, and this is what happens when you have these. So you need to be, when you pull the metals, when you're extracting those from the body, you're also pulling everything with it.
Mm-hmm.
That's the beauty, because they bind together.
Yeah.
And that's why chelation therapy is quite effective as a cleanser. And people have noticed, what I used to notice with patients before is they would take it and then their joints would feel better. And then they would find that if they had a problem walking up flights of stairs, that within a month or two, they'd be walking up stairs without being out of breath. Their legs would feel not so strained and stressed. And they just said it was just like wow, I feel new, because you're really are becoming like newly created, because you're getting rid of all the stuff that was binding you and holding you back from what your potential is.
So it's making you cleaner for
Yeah.
to put in. I have a dear friend and she is just in so much pain. She got a diagnosis of fibromyalgia, but I honestly, like, she has arthritis in her hands and everything, and I was thinking this would be beneficial to at least help remove some of the toxic load in her body and hopefully help with the pain.
Yep. And you could also use, of course, the DMSO we discussed last time. Uh, that can help in the process while you're doing it, because you may have certain pain. Like I say, the healing crisis happens when you start to release it. You may feel a little more, but if you do things right with the Optical, you shouldn't feel, really a healing crisis. But some people, depending on how toxic they are, they may feel it more, so they may have to up their CalMag to 3 twice a day.
You just gotta soak it up.
Well, yeah. Well, it's only temporary, it's only for the first couple of weeks. Once it starts to loosen, and then it starts getting better, and you start feeling the effect of it. And then you must, of course, have at least 2 to 3 liters of water. You must flush your system. Don't do it without flushing it, because once you release it and you don't give it the open up the floodgates, it's not going to flush it from the body.
Yeah.
And I recommend taking our pure vitamin C. That's the non-GMO vitamin C. So it's a cleanser. So you get that into your system while you're cleansing and pulling things out. Straight ascorbic acid that's non-genetically modified.
But probably some like sauna would be beneficial. Obviously, we should all be exercising at this stage. Very hot baths or showers, don't burn yourself, could be helpful as well, just to remove Epsom salt baths and bicarbonate of soda baths, just trying to pull it out and just help your body, I suppose, would be a good idea.
Oh yeah, borax, put in the bath with Epsom salts and some vinegar. And if you can get some nettle, because that's also very good, liquid nettle. Um, yeah, there's a lot of things you can put into the bath, and that'll help to flush out the system too. Get a good sweat going. Saunas are really good, infrared saunas.
Just back to the dosing, because I know you mentioned it really quick, and I know someone's going to ask. You said a bottle for each decade of your life. So if you're a 40-year-old woman, that's four bottles. Now, are we doing that every 3 months in a year, or are we doing the four bottles consecutively, or how would that be planned?
No, it's consecutive.
Okay.
So it's a program. And once you start, you stay with it and you cleanse yourself for that 4 month period. And you build up the your minerals again. And then what I would recommend probably after you go through the program is maybe take one capsule every every day or every other day throughout the year, just to keep yourself at a cleansed state.
If someone didn't do that, like one capsule every day, could they do then one bottle every year as more of like a maintenance or an extra cleanup or something?
Oh, sure. Yeah. Because within the way the world is now, how toxic it is, um, I would say at least every third year, if you're not doing a maintenance during the year, then you probably have to repeat. Probably, I used to say every 5 years, but now it's getting pretty bad.
Yeah. So what is the safety with doing something like this if someone already has kidney damage or liver damage, if there's already organ damage there?
Well, of course, we have to say you have to refer to your health practitioner for that because we can't say, oh, that's not no problem. No, you gotta. Everybody is different how their bodies react. This is a product that we're talking about someone in fair shape. Um, they may have realized they need to get things out of their body, and they see they're sluggish, and they they want to get take a new load on life, and they want to get rid of these things, and they want to start getting back. Well, really, I think today we just have to fight to stay healthy.
It's hard work, let me tell you.
Yeah, I mean, you just can't sit on your laurels and say, "Oh well, I'll be fine." And even the young is it's not. This is a toxic world, especially North America.
Yeah. It is hard, I have this conversation a lot with the guys and girls in the gym, and I'm like, I don't know if people realize how hard it is to get to the gym every day and push yourself to do really hard things and then make the hard choice to eat healthy and go for a walk instead of watching Netflix and go to bed. And like, it's that saying of choose your hard, but it's like really hard to be healthy. It's not as easy as some of us might make it look.
No, no, no. It's an effort, but it's a lifestyle. Once you get into the lifestyle and you realize that uh, you're doing this for yourself. I mean, this is a life insurance policy that you're investing in, and you don't want to be a ward of the state. That's the worst thing. I think that'd be a nightmare for me.
Oh,
Is
absolutely.
is to be subject to someone else who's taking care of me. Nope, nope, nope. That won't work.
Well, one of the questions, Dr. Dahl, that I got over the summer a few times was, of course, a lot of camping going on in Canada and people message. And one specific lady messaged and asked me if there was a parasite cleanse I would recommend for her little kids. I think her kids are 3 and 5, so they're pretty small. And I was like, well, I don't know if I would do a parasite cleanse. You could be opening Pandora's box. But a lot of people ask about parasite cleanses and some sort of, well, heavy metal detox. Um, and especially those around horses, equine, like the whole lot. Would this, in my opinion, would be for anyone, I'm sure there's like an age limit within
Yeah.
age that if they wanted to do a parasite cleanse or a heavy metal detox or something, this might just do it all.
Well, I would put boron into it, our fortified boron. Boron helps with eliminating parasites,
Mm.
and it also pulls out fluoride. So those are two things that we're fighting with today,
Yeah.
and especially in Calgary, where they're putting it in the water.
Yeah, it's crazy.
Yeah. So if you read our newsletters, we're trying to educate on what's going on, and boron is found to be able to pull these things out, and parasites don't like it.
Yeah. So what about then claw for people that maybe have SIBO or yeast overgrowths or something? Would it be applicable there?
Well, it's a cleanser. And any time you open up the pathway to clean your arteries, and if you're flushing that much water out, and the claw is being flushed through the system, through your bladder,
Mhm.
through your bowels, then it's going to start working on that department too.
So we'll grab some of those pathogens on the way out.
Sure, they will.
And that would, I'm assuming that would go for mold toxicity too.
Well, that's why I like the vitamin C under this program, because straight ascorbic acid is it kills a lot of things.
Yeah. So another question, I'm sorry, I just have so many questions about this product because I think it would be valuable, especially for people who seem to go out of their way and order cleanses and detox products and chelators from the States when we have something local that might be more effective. So what about this is a two-sided question. Someone with a cancer diagnosis, if they decide to not go through conventional treatment, would
Mhm.
this be a good option for them to, along with whatever other natural and holistic approaches they decide to take? And then the other side is how would this be used if someone is doing conventional treatment like chemo?
Oh, you want to get me into trouble.
I just have a curious mind. That's why people like me.
Yeah, those type of things. Those are called your sacred cows.
Mhm.
You can't say things about them because those freedom police will come all over you. You can't talk about the big C word because they make too much money on it, so they don't want to lose it. So
Yeah.
I I I can't say that it could be used, but if you have a good practitioner, health practitioner, and they read the ingredients in this formula and what we're recommending, they might be able to lead you, one-to-one level and tell you the goods. Uh, I personally would, of course, do it because I know what it does.
Well, we know that, like, if we're looking at the natural approach, a lot of toxicity is involved in cancer proliferation and the inflammatory aspect of things. So it would make sense that it would be a good idea.
Well, if you're pulling toxins, if you're breaking apart things that have a shelf life or a half life of 25 years in your bones, and these start releasing over a time period, and you start to feel a cleansing happening, then you're going to see that sometimes you don't need some of the other treatments, like the IV chelation is. They bypass the bypass by doing this,
Mhm.
and it's it opens up your arteries when it pulls. these ingredients, it has arginine, it has L-carnitine, and it has hawthorn. These are all for the heart. So you can see how it's going to work with the body and the heart and the blood pumping. And then, of course, it has your ingredients that help to take it out and release it. So now not only is it benefiting your body in several ways, but now once it benefits, once it pulls, now it can flush the excess or the things that you don't want in your body out, your toxins.
And help you, allow you to heal properly.
Yeah, yeah.
You mentioned plaque a few times, so I want to just circle back to that. You'll be glad to know I'm coming to the end of my questions. You're like, I'm never going back on that show again. She keeps hitting me with curveballs. But the plaque aspect, one of my friend's mom was going for heart surgery, and they went in last week to try scrape some of the plaque out of her arteries, but it turned out that when they got in there, there was too much damage done, too much plaque. So sent her home with some extra strong statins and take care of your diet, take care of your exercise, all that kind of advice. And then another dear lady I spoke to this week, I was shocked to hear she just had a stroke as well. So we know cardiovascular disease is the top killer of women. But because you've mentioned plaque so much, this can help to clear the plaque. Is that what I'm hearing correctly? To clear the arteries?
That's what I designed it for, to clear the plaque from the arteries so the arteries can freely flow.
And how effective is it? What I mean is, have you looked at before and after arteries? Because someone's going to ask this.
We have done studies and tests, and we found that it has been beneficial. You can see the difference before and after.
Mhm.
And that people can do that before they start, and they could get a blood test for heavy metals, and they could get a heavy metal test at the end and see the difference.
Yeah, this product seems like a big deal, Dr. Dahl. Like, and to be able to do something like this at home, I feel most women at least should be doing this.
Yeah, but just don't tell anybody about
Do you have a preference? Do you see it works better in women or men because men's livers tend to work better? Like, have you seen anything like that?
it. We find it helps either way.
What about ages? Because I mentioned my client with the little kids. What is the youngest age we could use this on? And I suppose the oldest age.
Well, I mean, the youngest on the label is adult, so 18. The oldest is, if you're still functioning and pushing blood through your veins. Yeah, there is no age limit.
Some of
Um,
these, though, some of these teenagers are bigger than me. Like they're
well,
more
I know.
adult than I am.
Oh no, I know that. We're talking when we talk 18. Uh, today's child is not like an 18-year-old from before. I mean, they're entering. Girls are entering their periods at 10 and 11 years old, 9, and
I heard of
so
one recently locally, who got hers at 6, which is I can't imagine the fright she got, but it's just that's mind blowing.
yeah, it's working. That's why the HGH helps those people so much, regulates back your hormone levels for children.
So for the parasites, back to the my client with her 2 little kids, probably your liposomal vitamin C would be the best option there.
That would probably be one of the best. Yeah, parasites and like I say, the boron.
So I know I recommend your products are gotten a lot in community foods here in Calgary. Of course, you have your website. I have it on my website as well. co-op carries some of your stuff. Sometimes Nutters in Airdrie. I don't know what it's like up where you are, but where is carrying Claw now? Where can people get it?
Well, probably from your website.
Which connects to yours.
Because it's you know, stores haven't really got into it, ordering the kit,
Yeah.
and we've not really pushed it too much to stores because it's an education process,
Mhm.
and people that work in stores, unfortunately, they don't get the knowledge and understanding how to sell something like this. So and like I say, we can't sell claw separately because of the healing crisis that could go if they took the wrong things and took it the wrong way, and they didn't have the water and they didn't flush. And so we put it in the kits, and we sell it through certain health stores. They can order it for you.
Mhm.
If you have a health store that you normally buy your products for, you can ask them to order it from Life Choice, and we'll send it to them.
Yeah.
They can buy it there. That's perfectly fine.
Mhm.
But the stores to understand, it's just too great of an education curve for this product.
Yeah, I
There's too
think
many
it's
questions. I mean, look at you.
yeah. I email you all my other questions. I think there's an element of trust as well there. Like for a product like this, you need to have some sort of relationship with a practitioner that you would trust them enough to do something like this rather than just going to a store and say, hey, what would you recommend as a binder?
No, it wouldn't work. No.
So, Dr. Dahl, a pleasure again. Sorry for all the curveballs, but I have to ask these questions.
Well, you have to, because it's not only for you. Your listeners are going to be listening to this, and they're going to have probably a dozen more.
Well, I hope I got to the majority of them, definitely the more common ones, because I do get a lot of questions about parasite cleanses and mold detox, and then of course the yeast, the SIBO, heavy metal detox. Oh, one last thing before I let you go, which I did want to ask you, is the neuroinflammation aspect. So you mentioned the buildup of, I think you said aluminum, mercury, fluoride, all of this fun stuff in the
Lead, yeah.
pineal gland,
Uh-huh.
and not just in the pineal gland, all around the brain. And then people have a lot of neuroinflammation, but I don't think a lot of people know to put that name on it. Like they're feeling it, but they don't know to call it that or that's the name for it. But this would help to remove a lot of that plaque because a lot of people, a lot of my friends, a lot of my clients, midlife women especially, there's a lot of talk about dementia nowadays. A lot of people are afraid of getting some form of dementia, and we know these plaque builds up and toxin and neuroinflammation is a factor.
No, I mean, there are treatment modalities there for treating and preventing Alzheimer's and dementia, natural medicine. And I think in today's newsletter, we're talking about lithium, on what it can do, the new discovery. I don't know if you heard those, that was in the press,
Yeah.
that how they were giving lithium in an orotate, and it was preventing those from getting Alzheimer's disease. Now, lithium is, of course, we have lithium in a homeopathic form. And so there are modalities that help that. And now for claw, when you take claw, these the ingredients in claw can do multiple things in the body. That's why it was designed this way. And so when it carries, it goes to take the plaque because it's designed to chelate, to claw it away. So it's designed to claw the things that are not meant to be there, and that doesn't harm the natural brain, but it just claws away at the things that it's bound to, and it's bound to the heavy metals, spike proteins, and the things that are are binding onto our bodies and our joints and our arteries and the inorganic calcium.
So does this medical grade EDTA cross the blood-brain barrier?
It does.
Okay. All right. Interesting. Well, maybe we need to start putting lithium back in our 7 Up again.
Well, it would be a great idea, but people would take too much.
Well, and then their teeth would probably fall out. We'll
Yeah,
make it, we'll
you
just put
want to
it in
take
the water.
you need to put low dose. It's only low dose that will work.
Mhm.
And that's why I think the homeopathic is your safest bet for every age. And it's so great. I mean, you don't loop. You know, when you take lithium before bed, like you may have thoughts and thoughts and thoughts. You take this, clears that right out. You don't loop anymore. You don't stammer. You don't. It, some of the testimonials have been phenomenal.
Does it attach to the GABA receptors?
Which one?
The lithium, does it attach to the GABA receptors?
Well, I'm not sure if it does, but what it does is it works on the body, and it's just the amount of lithium that can effectively have our bodies break down what it needs because we don't have enough
So
in our body. We don't have enough lithium and the other trace minerals.
I would
They're very
wonder,
important.
I would wonder if it also helps to metabolize adrenaline better as well.
Well, as I say, once you start having your body have nutrients that open up pathways, like we when I talk about our neurotransmitter support for the brain, it opens up the synapses of the brain so it has everything. It fires the neurons differently when you take the product. And so this is what happens when you have products that cross the blood-brain barrier, and they can fire neurons and open up pathways that may be blocked. And so this is where um, we can't go into great detail and say exactly what it's going to do as soon as it enters into the brain of a person or into the arteries. Everybody will be different, how much plaque they have in this nature, and how they take the product. If they follow the instructions, they'll get benefits. That I can say. But to know how far you can actually go with a treatment, it's impossible to know that.
Yeah. It surprises me that a lot of people think that you can't get lithium without a prescription, but you can. You can get it in a store.
You can.
I've seen it locally. I will tell you in
Yeah, but that's
private.
that's illegal.
I'll tell you in private, but
Yeah, I mean,
um
lithium is a prescription drug. We used to sell lithium as an orotate when I was in practice. And before licensing came, we used to sell 5 milligram lithium orotate, and it worked great.
how long ago
Worked.
was that before they changed the licensing rules?
Before 2009, they were working on that in 9 and 10.
That's interesting because I definitely have gotten it in the last few years.
Yeah, no, it's under the counter. That's
Well,
what we call it, under the counter products.
we better leave it at that before we both get knocks on our door.
Yeah, no. But
Okay.
we were able to license lithium in a homeopathic, which incredible. It's incredible. It lengthens the telomeres. It does so much for you for anti-aging. It's uh, wow. Just
Another
do some
conversation.
research.
Yeah. Brilliant, Dr. Dahl. A great conversation again, as always. We'll be in touch. If I
Okay,
hear any testimonies about claw, I do intend to try it myself, especially for my gallbladder. We'll let you know. We'll send them over to you and your guy.
please do. Please
Absolutely.
do. And if people are willing to do some blood tests, then that'd be great to have. We could share that with a lot of people.
This
Uh,
would be reflective on a hair mineral test as well for testing heavy metals.
it would help. Yep,
Hmm.
yep, yep. It will show the difference.
Okay, well,
And certain healers can feel the difference too, with the difference. Yep. So yeah.
okay. Well, Dr. Dahl, everybody, check out Dr. Dahl's website, lifechoice.com. I'll put all the links in the description. You can get his newsletter there. I like a lot of your stuff on Instagram, especially your Doctor's Corner. I like that. So I'll put the links in the description. Thank you for your time again. A pleasure as always.
Thank you. It was a pleasure for me too, and it's nice to be able to share your information with others, and they can bring it out to the rest of the world, and we can help people heal. That's the main thing,
Yeah, especially locally.
especially locally. Yeah, because we have to rub shoulders with them, so we want to have them in good shape.
Yeah, that's true. Okay, bye, Dr. Dahl.
Goodbye.